Historically, we always focused upon greenhouse gas emissions. That's very important, but the climate is changing already. We're going to see climate change continuing into the future. So there's increasing interest at all levels of government on finding ways in which we can help manage the negative effects of climate change and take advantage of new opportunities. And this is where adaptation comes in.
Human survival has always required adaptation, occurring when changing conditions have demanded new ways of living. In the case of climate change, adaptation is key as changes are happening rapidly and impacts are already affecting the everyday lives of peoples and communities around the world. Those that are remote, socioeconomically and politically marginalized, and dependent on the natural environment for livelihoods are particularly sensitive to the impacts of climate change. Changing conditions and climate stresses can exacerbate existing health problems, which can in turn reduce a population's resilience or ability to recover. Some of the most notable climate change impacts have significant health implications, adding an additional burden to ongoing health challenges. This project examines the vulnerabilities of Indigenous populations to the health effects of climate change and seeks to assist remote communities in Peru, Uganda, and Canada adapt to ongoing changes. The Indigenous Health Adaptation to Climate Change, or IHAC research program, is a multinational, multidisciplinary, 5-year project dedicated to understanding the vulnerability and adaptive capacity of remote Indigenous communities to the health effects of climate change. IHAC aims to promote adaptation planning, increase resilience, and develop research partnerships with Indigenous communities. The IHAC team and its partners are focusing on climate change impacts on Indigenous ways of living, asking, how is the health of Indigenous people currently affected by climate and weather? How might future climate change affect health and well-being? What social and economic conditions will affect the vulnerability of communities to the added stress of a changing climate? What opportunities are there to help people adapt to a changing climate? IHAC's Project Management Committee consists of primary investigators Dr. James Ford and Leah Barang Ford from McGill University in Canada, Drs. Victoria Edge and Shirley Harper from the University of Guelph in Canada, Drs. Alejandro Llanos and Cesar Cacamo from the Cayetano Heredia University in Peru, Dr. Schweib Luasa from Makerere University in Uganda, and Mr. Didakas Namanaya from the Ugandan Ministry of Health, supported by regional teams of both experienced and new researchers and students. IHAC also partners with communities, national, regional, and local government, and Indigenous organizations. The research team spent considerable time developing ethical protocols with communities and partner organizations before beginning the research, based on extensive working relationships with Indigenous communities and past guidelines of practice. The first task of the IHAC project was to develop an ethics protocol based on visits to the communities, meetings with local people, and partner organizations. This allowed the IHAC team to determine local ethical expectations and understand perspectives on how to work with the communities and possible risks faced by local people from the research. The project partners with communities by using participatory research methods, which means that the community is actively involved in all parts of the research, and both the process and the results are shared between the community and the research team as the project evolves. During fieldwork conducted in 2010, community members were given digital cameras, trained in basic photography, and asked to use photography to answer the question, how does environment affect your health? This method of research, called PhotoVoice, served as a basis for establishing the priorities that guided future work. Surveys looking at the burden of illness were then created from the emerging results of the PhotoVoice study. With the help of community members and local partners and students, surveys were conducted by local people in local languages across the regions. Partnering communities in the IHAC project have a rich cultural heritage and maintain strong connections to traditional knowledge. This traditional knowledge is central to the project, both in understanding the vulnerabilities faced and as a means of exploring opportunities for adaptation rooted in local culture and understanding of the environment. For its Arctic work, the research team has partnered with 2 communities that capture the diversity of Inuit settlements, livelihoods, health outcomes, and biophysical environments, Iqaluit and Rigolet. Canadian Inuit communities are among the most remote on Earth and inhabit a region that has been experiencing some of the most pronounced climatic changes globally. Despite being located within a high-income country, many health indicators in these communities are similar to middle and low-income nations, and are likely to increase sensitivity to climate change impacts.
Historically, Inuit have always relied on the land to provide for their needs. Food and water have traditionally been safe, abundant, and easy to access. Inuit hunters had a great deal of traditional knowledge, allowing them to take full advantage of their environment. But with recent changes in climatic conditions, some aspects of traditional knowledge are becoming less reliable, and country food sources have been harder to find and reach. The well-being of hunters has also been compromised as melting sea ice and permafrost have made the safety of traditional travel routes unpredictable. The uncertainty surrounding climate change has put a tremendous stress on Arctic life. As country food becomes less available, more and more people are turning to expensive and less nutritious store-bought food.
Also, some hunters have noticed changes in the quantity and quality of some freshwater drinking sources due to increased temperatures and rainfall, which has been associated with increasing reports of gastrointestinal illnesses around the community. Inuit have a strong connection to the land. It is a deep and fundamental aspect of their culture. Although forced into permanent settlements in the mid-1900s, the people continued to access the land. But with increasingly difficult and unpredictable climatic conditions and melting travel routes, it has become harder for Inuit to go out on the land and engage in cultural practices.
If it keeps getting hotter and hotter and hotter, then it's going to get worse and worse and worse. And then when you look at even the ice, how the ice forms and things like that, there's a lot of changes in that. And it's impeding people's ability to go out on the land and to trust the knowledge that they had before.
In the past few decades, the Inuit population has increasingly been eating more store-bought foods, which are very expensive in a northern context and often processed and less nutritious. The distance between Inuit settlements and southern food distributors is so far that fresh products are often not available and are usually the most expensive, about 4 times the cost compared to southern Canada. Other foods are mostly frozen, canned, or dried. With increasing use of store-bought foods in Inuit communities to compensate for lack of access to country foods exacerbated by climate change, education on how to choose from this selection is needed to help address food insecurity. Another priority for Inuit communities is tied to increasing incidences of diarrhea and vomiting due to changes in drinking water sources. Increased heavy rainfall has led to increased runoff, which can wash pathogens into brookwater sources and make water unsafe to drink. IHAC is working with 4 communities in the Peruvian Amazon: the Shipibo communities of Panaillo and Puerto Consuelo, and the Shawi communities of Nuevo Progreso and Puerto Porvenir. Each ethnic group has its own rituals, cultural celebrations, and each has a distinct spirituality, language, and community structure. Located in the jungle provinces of Ucayali and Loreto, these communities are physically isolated and highly dependent on local natural resources. The Shipibo and Shawi engage mostly in subsistence agriculture and fishing, as well as some low-wage labor jobs, and selling handicrafts. The surrounding rivers are the most reliable form of transportation, due to the lack of road infrastructure. However, the communities remain physically isolated and struggle to access medical services, local food markets, and artisanal markets. The recently changing weather patterns and changing river hydrology are also making planning and predictions difficult. The recent extreme climatic events, such as flooding in Ucayali, further exacerbate difficult living conditions. Communities have also reported their worst heat waves in the past couple years.
Cambio climático no es creo no una amiga de no, pero a través de lo que me echa unibonyuya tema y con algo que no.
Extractive industries are widespread in the area, including deforestation, commercial fishing, and oil exploration. These activities have changed local ecosystems and resulted in resource degradation, leaving the communities with fewer natural resources for their livelihoods. In our Peruvian communities, adaptation to the health effects of climate change means reducing the causes of existing social and economic vulnerabilities. In order to balance out the result of extractive industries, market access needs to be reinforced in the region. The revenues from the sale of handicrafts and agricultural goods are vital to their autonomy and for underpinning adaptation efforts for which access to resources is often of key importance. A better transportation structure would also provide better access to healthcare systems, time being crucial in a situation of emergency associated with flooding. Improving the educational system is also a major priority, both within the communities and by finding scholarships so their children can get higher education outside the communities. Political representation outside the communities is also a major issue. Official registration is necessary to process funding demand applications and other major governmental help. As research in multiple contexts demonstrates, education is often crucial for enabling adaptation.
Quiere que venga otro que progresa más, va a enseñar nosotros, a incentivar nosotros también, lo que no conocemos nosotros, enseñe para que se enseñe para hacer levantar. Por ejemplo, si mi hijo, aquí mi sobrino, está haciendo conocer tanto de medicamentos como para manejar, pues no quiero que bajen, que levanta, que conozca, ayúdenle a ustedes, que levanta, para que mañana más tarde ellos para que sean enfermeros ahí de aquí mismo. No queremos lo que viene de otro. A veces cuando viene de lejos, de Orimago, de otro país, cuando viene, se vuelve, no viene.
IHAC is involved with 10 Batwa Pygmy settlements dispersed around Buindi Impenetrable National Park in southwestern Uganda, on the border with Democratic Republic of the Congo. After being evicted from the forest after the creation of the park in 1991, the Batwa of the southern highlands of Uganda had to cope with dramatic changes in their lifestyle, including living in permanent settlements and adapting to agricultural livelihoods.
They are limited by the land resource. And even the current lands in the settlements that have been, or recently were involved in resolving disputes with the neighbors over the lands, because some of the neighbors had begun encroaching on the lands of the Batwa. And yet the Batwa are already, suffocated in terms of the land resource. They do not have enough land.
Dislocated from their traditional environment, the Batwa have struggled to adapt to life outside the forest. Previously a hunter-gatherer peoples, they are now engaging in crop agriculture and livestock rearing, but lack the extensive history and experience with farming of their non-indigenous neighbors. Poverty and poor health have improved in recent years due to the support of the Buindi Community Hospital, the Batwa Development Program, and others. Despite this, the Batwa still experience poorer health than their non-indigenous neighbors, and stigmatization and socioeconomic inequalities continue. Our Batwa partner communities are already facing a number of challenges, and marginal health status means that even small additional pressures can have a significant impact on Batwa livelihoods. Climate change is likely to affect rainwater throughout the dry season and rainy seasons, affecting crops. Many Batwa have small plots, often with poor agricultural productivity, and changing weather conditions may exacerbate food insecurity with important implications for Batwa health.
hato shange twazo mu kushakiriza mu bakiga tuza kurondera icyo kurya mbone kugira ngo ugire kutwabo tugota kuzira nkago magezi ti haruho dembe yitotunje ningoburamo ningoburunji butotungire muri settlement yitu.
Malnutrition, including not having enough food and not having enough diverse and nutritious food, is a significant challenge in Batwa communities who have identified food insecurity as a top health priority. Access to clean drinking water is also a problem in many communities, where water sources often dry up during the dry season, and other sources may be contaminated by runoff from animals or human settlements. Poor water quality and contamination can lead to diarrhea and vomiting. Increasing extremes in rainfall, including longer dry periods followed by heavy periods of rainfall, can increase the likelihood of contamination of water sources. Many Batwa communities are thus looking for ways to improve the quality of their water sources and avoid increased risk of contamination and illness. Food and water security are hence key health priorities in Batwa communities. Climate changes may also affect the risk of malaria amongst Batwa. Through the help of local health services, Batwa have been able to better access treatment and prevention services for malaria in recent years. Malaria continues to be a major health challenge in the communities, however, and little is known about how risks will change in the future. Changing temperature and rainfall affect how many mosquitoes people are exposed to, what times of year people are most at risk, and even the survival of the malaria parasites carried by mosquitoes. One of IHAC's main objectives is to study commonalities and differences between study regions in the context of a changing climate. The idea is to determine whether the factors creating vulnerability and promoting resilience are common across the populations being studied, and if potential generalizations for the global level can be developed. In order to understand these impacts on traditional lifestyles and livelihoods, we have to understand the specific context of each group. Food security, or having access to sufficient, safe, and nutritious food, is a challenge facing all the study regions, with food quality, access, and availability sensitive to climatic change and socioeconomic stress. Traditional foods are central components of diet in participating communities. In Peru and particularly Uganda, food security is a sufficient concern that many are malnourished. In the Arctic, poor nutrition, obesity, and diseases such as diabetes have been associated with poor food security. All regions are seeing rapid shifts in the type and availability of foods that they eat, often transitioning from traditional subsistence hunting or farming to purchase of processed or imported food products.
Entonces, haji ko burigi, o sea que nos ascaron, no vacubo no haukia maino. Antes solamente no había no haukia tipicati, pero ahora ya ha cambiado, cambia mucha cosa, haskare y ramaga. En vez que no son bote tiene abierta, ciudad y no abrir, no rama bueno. Ya. Para comprar eso a tipo de habrás como primeramente no aparte tiago. Ya para buscar algo de dinero para ir a la ciudad de la ciudad traer algo de comer, ¿no? Para dar nuestros hijos.
Climate is likely to affect the availability of animal and plant species traditionally consumed in indigenous diets. For example, some lakes in Peru are drying up completely in the dry season, and fish can no longer be caught. In the Arctic, changing sea ice conditions have made seasonal hunting more dangerous and may be affecting some animal populations. Climate change may make it harder for indigenous communities to benefit from their land's resources in ways they used in the past. Having access to enough safe, potable water, or water security, has direct and indirect links to health. Climate change has the potential to affect prevalence of waterborne disease through increased temperatures, changing precipitation, and flooding. Around the world, and even in developed nations with water treatment systems such as Canada, outbreaks of waterborne disease are found to occur more often following high rainfall events. Climate change projections predict warmer temperatures and more frequent intense rainfall events that may increase the likelihood of water contamination and illness.
Cuando se inició la investigación de CIAC en Perú, en esta comunidad, los investigadores fueron con los resultados a la Oficina de Salud Ambiental en Ucayali y les manifestaron que uno de los problemas más importantes para la comunidad era el agua, la calidad del agua.
Water sources that may once have been safe are now under pressure from increased use from population growth and may be more easily contaminated due to the presence of animals and human settlement. Climate change may exacerbate these pressures by increasing the likelihood of contamination. Heavy rainfall events and a combination of longer and more severe dry and rainy periods are believed to increase the risk of contamination. These types of scenarios are expected to increase in frequency as the climate changes. Ugandan and Peruvian communities in particular generally have poor to no water treatment and are thus vulnerable to increasing gastrointestinal illness. In the Arctic, permanent ice sources are disappearing slowly, making the ice melting technique more difficult for today's Inuit. These altered environmental conditions, amongst others, are exacerbating the already precarious water quality and quantity in IHAC partner communities. Infections that are transmitted by insects or vector-borne diseases are highly climate-sensitive since both the mosquito vectors and the malarial pathogens are affected by temperature and precipitation. Climate change impacts on vector-borne diseases are debated throughout the scientific community, but are expected to be significant and dependent upon local conditions and vulnerabilities.
This region where we are, didn't used to have malaria. It was actually a malaria-free area until maybe 2 or 3 decades ago. And the reason why we have malaria here is because of the changes in weather and climate. There was a slight increase in the temperature, which made it possible for mosquitoes to survive in this area.
This research focus is set in Uganda and Peru, mostly on malaria, where both community members and regional partners express concern regarding increased incidence in their communities. In our Peruvian communities, intensive campaigns have controlled malaria transmission, but concern remains that risk could reemerge. Malaria is still common in Ugandan communities, though transmission patterns are changing, and research can help identify evidence-based opportunities for reducing malaria burden. Though fevers are often assumed to be malaria, many fevers may be the result of other diseases, and malaria medication may not be appropriate. In our Ugandan partner communities, little is known about what proportion of fevers are actually due to malaria. In the Arctic, vector-borne diseases are not prioritized since future risk remains negligible. The IHAC team is currently building templates of an empirical quantitative analysis to see how much of the variation in health outcomes is attributable to variations in weather. It is difficult to measure direct climate impacts on health, but we can use changing weather conditions over months and years as a proxy measure of the extent to which health conditions might be sensitive to climate in the future. Qualitative research, meanwhile, is working with communities to understand in detail how communities experience and respond to climate-related health outcomes and how they may respond to projected future climate change. Combining quantitative and qualitative research approaches, the IHAC team is also seeking to identify opportunities for developing common adaptation activities. In what context are traditional activities promoting adaptation, and can we identify particular groups, places, or practices common among regions that are enabling health adaptation? In the coming years, the IHAC team plans to develop a standard protocol for training local adaptation leaders in all 3 regions in an effort to build adaptive capacity throughout all partnering communities. The team has also started to plan and implement regionally specific adaptation actions. In the Arctic, IHAC is beginning discussions with partners about potential adaptation opportunities. In Rigolet, Food Security Network of Newfoundland and Labrador and researchers at Trent University will be teaming up and rolling out an intervention to strengthen food security in the community. IHAC will work in partnership to evaluate this intervention for reducing the impacts of climate change on food security. In both Iqaluit and Rigolet, IHAC is working closely with local public health organizations to develop small public health campaigns and provide materials to healthcare workers about preventing and treating diarrhea and vomiting. A major focus of IHAC research in the Arctic is working with community members on traditional knowledge-based interventions. For example, land skills and knowledge underpins safe hunting in a changing climate, while knowledge on how to prepare traditional foods correctly is important in light of rising temperatures. Since community members in the Shawi community of Nuevo Progreso have noted the loss of traditional plant knowledge, IHAC has been involved in the construction of medicinal plant gardens. Fostering the intergenerational transfer of traditional plant knowledge can help provide relief from various maladies and build social networks. A lack of access to healthcare services is a serious problem for the communities in Peru. In the Shipibo communities of Panaillo and Puerto Consuelo, IHAC has sponsored 2 community promoters to complete a 4-month-long first aid training course. Upon course completion, the promoters will return to their communities and teach community members the skills they have acquired in the course. This capacity building will help the communities to better deal with health emergencies. In response to requests from partners and communities regarding concern over malaria risk, IHAC distributed mosquito nets to all community households early in the project. Redistribution and dipping campaigns to retreat the nets with insecticide are planned. Regular surveying to identify people with severe fever or positive for malaria has helped to improve malaria surveillance and increase the number of Batwa diagnosed and treated for malaria. To help reduce the risk of waterborne illness, IHAC installed the first of several rainwater tanks in the settlement with the poorest water quality. Rainwater is collected into a large water tank through a system of rooftop gutters. The costs of the lock and maintenance are shared between the community members who use the tank, supervised by the chairman of the settlement. IHAC is currently evaluating needs and planning for additional tanks to be installed in other settlements. Proactive climate change adaptation in our Ugandan communities means helping Batwa develop agricultural practices using crops and techniques that will prosper under a changing climate. IHAC is working with partners to identify existing development programs that can mainstream adaptation and climate change considerations into their development planning. This might mean considering drought-resistant crops or helping communities anticipate appropriate planting or harvesting seasons based on weather. Training programs to promote healthy and productive livestock keeping are also being considered. These programs will increase the range of food and income sources available to the Batwa and promote resilience through improved health and economic resources. In collaboration with the Ugandan Ministry of Health, IHAC is conducting an evaluation of existing health programs and policies to identify opportunities for improved programming that can mainstream climate change considerations. This means that health services would adapt programs in light of changing risks associated with climate change. This might involve improved or modified disease surveillance programs, new protocols for malnutrition and food security, and adapted water safety guidelines that account for different likelihood of contamination.
My name is Dr. Sam Okware. I'm the Director General of the Uganda National Health Research Organization. I oversee all health research in the country. This research is very important because one of my functions here is to make sure that there is knowledge translation from findings to sharing information with stakeholders and also to producing policy briefs and eventually incorporating this into effective policies and interventions. So I think this information from these studies can be extremely important because we don't have any information. So without any information, we cannot advance a policy.
The IHAC project works towards building capacity through the training of new researchers and students in all 3 research locations and in the exchange of expertise between universities and countries. Emerging results from the project are shared with the communities at feasts and other events organized by the research team. Reports are also shared with policy-making government agencies like the Public Health Agency of Canada, the Ugandan Ministry of Health, and local and regional health authorities in Peru.
The ones who want to improve the situation, I think must not give up, because the scientists, the researchers are so few, but history has shown us that so few have done so much for so many, and in fact for the whole of humanity.